Good afternoon. Today, I want to give you another update on COVID. I want to start by saying that historically, we, the human species, tend to think that we can control everything. This is very arrogant. We do not have a great track record at controlling viruses. In fact, in all of human history, we have only eradicated one human virus, smallpox, so it is unlikely that we will eradicate this one. We also know that COVID-19 behaves similarly to most viruses that we are familiar with. Nobody is to blame for this virus or its spread. Not the president, not the governor, not the kids who gathered at the park, or your neighbor who doesn't like to wear a mask. Let's think back to March and the beginning of this crisis. At that time, we had little or no information and few cases in the state or nation. Making decisions without information was obviously very difficult. Now, here we are, over 500,000 cases in Illinois and over 10 million cases in the United States later. With all of those cases, we have been collecting data, and a lot of it. The most important information that is being collected is COVID hospitalizations by date. This is shown here, but Cook County Department of Public Health stopped reporting it on October 28th. We know they have it, but they stopped reporting it. Why? We now know that the IDPH has an outbreak reporting system that it shares with our county health departments. I want to thank Trustees Healy, Milani, and Katsinas for joining me in passing a resolution asking the state to share this data last week. I also want to thank the regional mayors for joining together to ask for this information. Finally, on Friday, for the first time, IDPH shared the outbreak data publicly, though it is missing outbreaks associated with long-term care facilities. It also fails to show cases associated with these outbreaks, though it shows cases associated with outbreaks in long-term care facilities. Why did it take so long, and why is all the information not being released, and why is it not being reported consistently? It was frustrating and difficult to make decisions back in March without information. In November, knowing that the information exists and is not being shared is infuriating. Local leaders need information to make informed decisions to keep people safe, while also allowing them to live their lives as normally as possible. The governor and the state have indicated that they are now using COVID-like illnesses. This made sense back in March when we had no testing to identify COVID. COVID-like illnesses include the flu and pneumonia. Historically, hospitals become full from influenza and stop taking ambulances. What you see here is the amount of time hospitals spent on bypass annually, driven primarily by the flu in 2018 and 2019. Christ Hospital led the pack in 2019, spending 20% or 73 full days on bypass. In 2018, Northwestern spent over 1/3 of the year, a total of 131 full days, where it would not accept ambulances because of how full it was, driven by the flu. It does not make sense to use COVID-like illnesses when we test for actual COVID cases and are trying to make decisions about the COVID-19 pandemic. Here, you see the curves of COVID-like hospitalizations and actual COVID hospitalizations by date. Since there are several COVID-like illnesses, of course there are more hospitalizations due to this. To be clear, using COVID-like illnesses means that the state and governor will shut businesses, schools, and potentially order you to stay home because of the annual flu. This is not driven by data and science related to COVID. Since we have testing that identifies actual COVID cases, we should base our public health decisions using actual COVID data. Cook County needs to start releasing this information again so that we can make informed decisions. Also, rather than outbreak data, the state was releasing exposure data. Exposure data tracks where people who have contracted COVID have been in the previous 14 days. Number one in every county that I have seen are restaurants. Number two, according to the state, are schools. For example, if a person contracts COVID and goes out to lunch every day, that would be 14 visits to restaurants. If it is a child in school, every day they were in school would count. What exposure data really tracks are people's normal behaviors. You would get the same information from anyone, whether they had COVID or not. That is why experts, both medical and mathematical, tell us that exposure data is not predictive for the disease of COVID. Rather, you need to track where outbreaks have occurred and understand if the people knew of COVID-positive people they were exposed to. What we know from this tracking is 2/3 to 3/4 of cases come from homes or private social gatherings. Outbreak locations are a small percentage of cases, but also provide valuable insights and can help us learn how to keep those locations safe. The state finally started sharing this information on Friday, dating back to July 1st. The information is enlightening. Statewide, 4% of outbreaks, not including long-term care facilities, are due to restaurants, and 5% due to bars since July 1st. These numbers do not include outbreaks in long-term care facilities that are not reported on the IDPH site. In DuPage County, only 23% of cases are not from long-term care facilities. Applying this information to the state would indicate that only 1% of outbreaks are from restaurants and 1.2% from bars. Locally, the Cook County portion of Orland Park is Region 10. The Will County portion is Region 7. Since July 1st, there have been 0 cases in restaurants or bars in either region. You heard that correctly, 0. Based on this information, the decision to close restaurants and bars is not due to data or science. So why are they being closed? The state is also failing to show other critical outbreak-related information, such as how many cases are coming from each outbreak. DuPage County shares this information as shown, so we know the state has it. DuPage County data shows that restaurants only account for 1.4% of outbreak-related cases, and a whopping 77% come from long-term care facility outbreaks. The city of Chicago has indicated that about 1% of their outbreaks are from restaurants. Since Cook County isn't sharing the data, we can infer that suburban Cook County is similar. We also know that 9 of the 10 worst outbreaks in Illinois come from prisons and long-term care facilities, which the state is solely responsible for regulating. Moreover, 51% of deaths in Illinois and 98% of deaths in Orland Park occurred in long-term care facilities, while long-term care facilities only represent 7.4% of statewide cases. This begs the question, why are we focusing on restaurants and bars, and why are we not focusing on long-term care facilities? Based on what is being reported, we know that the cases are higher now than they were at the beginning of this, in spite of all of the mitigation efforts we have taken. Our efforts were supposed to flatten the curve and protect the healthcare system. The Restore Illinois Phase 4 was in place for 3 months before this massive increase in cases. Based on statewide IDPH COVID reporting, COVID hospitalizations are up, but not at the level we saw at the peak in the spring. In the spring, approximately 20% of all cases were hospitalized. Since July 1st, only 2.5% of cases in suburban Cook County have been hospitalized. Also, Illinois had a case fatality rate of 4.8% through July 1st and 0.9% since. It is important to note that the case fatality rates are deaths with COVID, not necessarily from COVID. In Orland Park, this case fatality rate was 5.9% through July 1st and is 0.4% since. We also know that 9.8% of cases in Illinois are age 70 and over, but they represent 71.4% of deaths in the state. Additionally, 30% of those that are between 70 and 79 and 38% over 80 are hospitalized in suburban Cook County upon contracting COVID. The fatality rates are 9% and 21.7% respectively. Today, I have shown you a lot of information and pointed out data that is being collected, and much of it is not shared. So what do we really know? First, in the midst of rising cases, there is a lot of good news. Hospitalizations due to COVID and deaths with COVID are down significantly. We know more about the virus and have better treatments available as well. Second, one thing has remained constant since the beginning is that seniors, particularly those with other health-related conditions, are particularly at risk. Third, we know that most of the current spread is coming from home and private social gatherings. Okay, but what does all this mean? First, we know that it is not feasible to shut down our economy and the livelihoods of millions of people every flu season. We should all be considerate and try to protect others, but it is most important that those that are over 70 and those with conditions that make them vulnerable protect themselves. You simply cannot know if the hundreds of people you may see in a week follow good hygiene practices or whether they are sick or not. So please protect yourself. Second, it means that we need to pay special attention to social gatherings over the holidays. It is unrealistic to think that families and friends will not gather during the holidays. In fact, not meeting may have negative effects that outweigh the benefits. It is also entirely unrealistic and unlikely that family members and close friends will wear masks or social distance at these events. So what I would strongly recommend and urge is that if you're in a vulnerable population, protect yourself by either staying at home or by wearing an N95 mask that will protect you from others. Even more importantly, if you have any symptoms of being sick, please stay away from these gatherings. As hard as this may be during the holidays, please do not risk exposing your friends or family to whatever you are sick with. Finally, I will continue to call on the state and county to be transparent and show us all the information they are using for decision making and all the information that they are collecting. We are capable of sifting through the data and making our own decisions, but we need all of the information. Our lives and our livelihoods are dependent on making informed decisions, and this information is critical. The citizens of the state of Illinois, Cook County, and Orland Park deserve transparency. Thank you all very much for the sacrifices that you have made throughout this crisis. Also, thank you for remembering that while we are in the same storm, we are in very different boats. Everyone's circumstances are different. The efforts of the residents of and visitors to Orland Park have allowed us to adapt and operate more safely in the current environment. This does not mean that we won't have more cases, because we most certainly will. However, here in Orland Park, we have struck a balance that has helped many people keep their livelihoods and allowed others to live their lives as normally as possible while also keeping people safer. We have done so and will continue to do so by being transparent, by keeping people informed with the data and science that is available to us, and by allowing our residents and visitors to make their own informed decisions. Thank you.